A patient suddenly begins choking and cannot speak. What is the first action a CNA should take? A. Call the nurse and wait. B. Perform the Heimlich maneuver immediately. C. Give water to help them swallow. D. Pat them on the back gently. Answer: B. Choking with inability to speak indicates complete airway obstruction. Performing the Heimlich maneuver immediately can save the patient's life. While transferring a patient from bed to wheelchair, the patient starts to fall. What should the CNA do? A. Let the patient fall to avoid injury. B. Quickly support and guide the patient to the floor safely. C. Hold the wheelchair back and pull the patient up. D. Call for help after the fall. Answer: B. Safely guiding the patient to the floor reduces the risk of serious injury. Immediate assistance prevents trauma. During a fire drill, a CNA notices smoke in the hallway. What is the correct priority? A. Evacuate ambulatory patients first. B. Grab equipment before evacuating. C. Close all doors and windows and then evacuate patients. D. Call family members first. Answer: C. Closing doors limits fire spread, ensuring patient evacuation follows safety protocols while protecting life and property. A patient on oxygen therapy is smoking in their room. What is the safest action? A. Remove oxygen and continue monitoring. B. Immediately stop smoking and report to nurse. C. Allow them to finish and then educate. D. Ignore as long as oxygen flow is low. Answer: B. Oxygen is highly flammable. Immediate intervention prevents fire hazards and ensures patient safety. While checking a patient, you notice a frayed electrical cord on a bedside device. What should you do? A. Continue using it cautiously. B. Unplug and report immediately. C. Tape the cord and continue. D. Move the device out of reach. Answer: B. Frayed cords are a serious electrical hazard. Removing the device from use and reporting prevents potential shocks or fire. A CNA notices a patient has fallen but is conscious and alert. What is the first step? A. Help the patient up immediately. B. Assess for injuries and call the nurse. C. Move the patient to bed. D. Document the fall first. Answer: B. Assessing injuries ensures appropriate care before moving the patient, preventing further harm. During a code blue, a CNA's role includes: A. Performing chest compressions alone. B. Clearing the area and assisting healthcare providers as directed. C. Giving medications. D. Moving equipment away from the patient. Answer: B. CNAs support the medical team by ensuring space, fetching supplies, and assisting under supervision. A patient's bed rails are left down, and they attempt to get out unsupervised. What is the safest intervention? A. Leave the bed rails up at all times regardless of patient comfort. B. Raise the bed rails, ensure call light is accessible, and educate patient. C. Tie the patient to prevent falls. D. Keep the patient in bed at all times. Answer: B. Proper bed rail use prevents falls while maintaining patient autonomy and comfort. While performing routine care, a CNA notices a chemical spill on the floor. What is the priority? A. Inform a colleague and continue care. B. Isolate the area, follow facility protocol, and report. C. Clean it immediately with water. D. Ignore if no one is nearby. Answer: B. Isolation prevents slips or exposure, and following proper protocol ensures safety for staff and patients. A patient starts having a seizure. What should a CNA do first? A. Restrain the patient to prevent movement. B. Move objects away and protect the patient's head. C. Insert a tongue depressor to prevent biting. D. Leave the patient alone. Answer: B. Protecting the patient from injury without restraining ensures safety while waiting for medical help. When a fire alarm sounds in a long-term care facility, what is the first priority? A. Save patient belongings. B. Evacuate non-ambulatory patients first with staff assistance. C. Finish current task before evacuation. D. Lock all doors. Answer, B. Ensuring patient safety and orderly evacuation is the top priority over property or tasks. A CNA notices a patient's line has become disconnected. What should they do? A. Reconnect the line themselves immediately. B. Clamp the tubing and notify the nurse. C. Ignore if the patient seems fine. D. Flush the line with saline. Answer, B. Clamping prevents air embolism or contamination. Notifying the nurse ensures proper management. While assisting with ambulation, the patient complains of dizziness. What is the correct action? A. Encourage patient to continue walking. B. Stop immediately, provide support, and return patient to bed. C. Apply a tight grip on the patient's arm. D. Give water and continue walking. Answer, B. Sudden dizziness can cause falls. Stopping and supporting prevents injury. A patient's call light is not within reach, and they press it repeatedly. What should the CNA do? A. Ignore since the patient can reach later. B. Move call light within reach and ensure patient safety. C. Tell the patient to get it themselves. D. Cover the call light. Answer, B. Call light accessibility is critical for patient safety and prompt response. A CNA smells smoke while passing a patient's room. What is the first step? A. Investigate immediately alone. B. Activate the fire alarm and follow evacuation protocol. C. Open windows for ventilation. D. Ask patient if they are cooking. Answer, B. Immediate alarm activation ensures safety. Evacuation follows facility emergency procedures. A patient with a known fall risk tries to climb out of bed unassisted. What is the safest response? A. Restrain the patient immediately. B. Gently guide back to bed, ensure call light is within reach, and notify nurse. C. Ignore to respect autonomy. D. Put bed rails up without explanation. Answer, B. Guiding and supervision prevent falls while respecting patient rights. While performing CPR, a CNA notices the patient has a pacemaker. What should they do? A. Avoid compressions over the pacemaker site. B. Continue standard compressions. C. Turn off the pacemaker. D. Only perform rescue breaths. Answer, B. Chest compressions are still performed. Minor pressure over pacemaker is acceptable during CPR. A patient has spilled hot tea on themselves, causing a burn. What is the priority? A. Apply ice directly. B. Run cool water over the burn and notify nurse. C. Cover with a blanket. D. Rub the area. Answer, B. Running cool water reduces tissue damage. Notifying nurse ensures proper treatment. During an earthquake, the CNA is assisting patients in a long-term care facility. What is the safest action? A. Evacuate immediately through stairs. B. Drop, cover, and hold under sturdy furniture until shaking stops. C. Run to exit immediately. D. Ignore and continue care. Answer, B. Protecting self and patients during shaking prevents injury. Evacuation follows afterward. A patient is unresponsive and has no pulse. What is the first action? A. Check for breathing and call for help while initiating CPR. B. Shake patient vigorously. C. Give water. D. Wait for nurse. Answer, A. Immediate CPR and calling for emergency help is critical for survival. A patient with mobility issues is left unattended near the bathroom and falls. What is the CNA's best response? A. Call family immediately. B. Assess injuries, provide support, and notify nurse. C. Leave patient to get help. D. Move patient without assessing injuries. Answer, B. Immediate assessment prevents further injury and ensures prompt medical attention. A patient's oxygen tubing is tangled, causing risk of tripping. What should the CNA do? A. Untangle tubing and ensure proper placement. B. Cut the tubing to free space. C. Ignore unless patient complains. D. Remove oxygen temporarily. Answer: A. Untangling reduces fall hazards and maintains safe oxygen delivery. During a power outage, which patient requires immediate attention? A. A patient in a private room watching TV. B. A patient on life support equipment. C. A patient sleeping. D. A patient eating lunch. Answer: B. Life support patients are highest priority, backup power and monitoring are critical. A patient starts having a seizure while eating. What is the CNA's priority? A. Stop feeding, clear airway, and protect from injury. B. Forcefully hold utensils. C. Continue feeding. D. Give water immediately. Answer: A. Protecting airway and preventing injury is critical during seizures. A chemical used for cleaning spills splashes into a CNA's eye. What is the first step? A. Rub the eye. B. Rinse immediately at the eye wash station for at least 15 minutes. C. Cover with a cloth. D. Call the patient's family. Answer: B. Immediate flushing prevents chemical injury and reduces risk of permanent damage.